No Tobacco Day is observed on May 31st annually with a goal to combat the increasing prevalence of tobacco consumption all around the world due to its hazardous health effects on smokers and those who are exposed to second-hand smoking. Well, the theme of this year is We Need Food, Not Tobacco. It's estimated that there are more than 1.3 billion tobacco users worldwide, which represents 22.3% of the total global population. Over 80% of these tobacco smokers are mostly residing in low and middle income countries of Latin America, Africa, and Asia. According to a recent report of the WHO, tobacco-related ailments kill about 8 million people each year around the world. In Nigeria, the WHO has estimated that over 30,000 Nigerians die yearly as a result of tobacco-related diseases. Let's now talk to the head of radiotherapy department of Lagos University Teaching Hospital, who is also the lead oncologist at NSIA LUTH Cancer Center, Dr. Habibu Mohammed Yakub. Thank you for joining us on the news at 7. So we hear that cigarette smoking is a leading risk factor for throat and lung cancer. What really makes tobacco carcinogenic?
Well, tobacco contains up to 8,000 toxic agents. Of these, about 7,000 are carcinogenic. That's they can predispose to cancer. And like rightly said, tobacco can increase the risk of cancer all parts of the body. However, more significantly, the respiratory tract, that's the head and neck, like the throat, the pharynx, the larynx, even the mouth, oral cavity, and more importantly, more significantly, the lungs. Tobacco is the most related cause of lung cancer. And lung cancer used to be the first, that's the highest cancer in the world, until very recently when it was overtaken by breast cancer. And 11%, more than 11% of all cancer is lung cancer. It's also more common in other parts of the world, even in the developed part of the world, than in Nigeria. Lung cancer takes about 14th position in Nigeria. It's not very common in Nigeria, but it's not that rare either. And the problematic issue about lung cancer is that lung cancer is very worrisome. Most of the time, it's diagnosed late. Usually, they come late because of misdiagnosis. Usually, tuberculosis is usually what is diagnosed in place.
Well, I'm just wondering, Dr. Habibu, if you can hear me, which tobacco we're talking about, because, some would tell you, I have a grandfather who has been smoking since a very young age, and
in our environment.
He died at an advanced age. If you can hear me, Dr. Habibu, did something change in the content of the cigarette over the years? Because cancer wasn't quite as prevalent in those years as it is now.
Well, cancer has been prevalent. Like I said, cancer has been the highest cause of cancer. Lung cancer has been the highest cause of cancer death in the world, even though it's not that prevalent in Nigeria. But even in Ghana, lung cancer is like third on the list. But in Nigeria, it's a bit low compared to most part of the globe.
So talk to us about what you have experienced, working in the cancer unit yourself. What has been the situation like in Nigeria?
In Nigeria, we do have patients with lung cancer, but most of the time they present late because they are usually misdiagnosed. And lung cancer, if they present late, when present late, there is hardly any curative treatment you can give, because also lung cancer at early stage can have surgery, but at late stage it becomes very difficult to manage. However, with as of today, we are having some improvement as patients are coming a little earlier than they used to come. And I know that in the last 1 year, I've seen 2 or 3 cases that have come relatively early, and they've had good treatments in this center.
Okay.
They had chemotherapy and radiotherapy, and they are still, coming for visits, and they are doing well. But largely, most of them present late when it's already causing respiratory distress.
In an advanced stage. I get you. We have to go now, Dr. Abibu.